Hey everyone, it's Sarah with RegisteredNurseRN.com, and in this video I want to be talking about the growth and development of the school-age child. And as always, whenever you get done watching this YouTube video, you can access the free quiz that will test you on this content. So let's get started. When we talk about the school-age child, we're talking about children who fall within the ages of 6 to 12 years old. Now in the previous reviews, we talked about the growth and development of the infant, the toddler, and the preschooler, and then next we're going to talk about the adolescent/teenager. So the school-age child falls within that range where they quit being a preschooler, but they're not quite yet an adolescent or teenager. So our school-age child, they are really growing and developing and trying to discover their role in this world. And a main driver in helping them do that will be, of course, their parents, but something else is going to be thrown into the mix. This is when they start school. So school is going to be a big driver with this because they're going to start having that peer-to-peer relationship with other people, and they're going to start having relationships with someone other than their parents, such as their teachers. So this is really going to help them grow and develop. Now, to help us remember all those main concepts we need to know, we're going to remember the word school. So first is S for skills. The school-age child has learned so much up to this point. They started learning whenever they were a baby all the way to the time whenever they were a preschooler. So they're taking those skills, they're mastering them and fine-tuning them, but they're building upon them and they're becoming very independent with them. So first, let's talk about fine motor skills that they have. Well, these are skills that use those smaller muscles, and one skill that they're going to start getting really good at is writing, and of course school is going to be a main driver with that. So not only are they going to start out writing their name, but they're going to start writing sentences, which are going to evolve into stories. Then they're going to learn how to draw with greater detail. So they'll start out maybe as little stick people here, but then their drawings can start having more detail to them. They can also begin to learn to type and do complex tasks that are required in cooking and cleaning. Next will be gross motor skills. These are skills that use those large muscles. So the school-age child loves to be active, and they definitely are using those larger muscles. So they're going to really learn how to ride their bike without training wheels. They're going to learn how to start using skates and scooters, and they're going to learn to swim. Now, our school-age child loves to compete with their peers and be very active with their peers. So this is a time where they love to be in team sports, competitive sports, and then plus they like to start having hobbies. Next is cognitive skills. So at this age, children have an increased ability to pay attention and to concentrate, which is very useful in the school setting. So now they can memorize and learn material. They can also learn to read, and as time goes on and they practice their reading skills, those skills will even advance even more. Next, they can learn how to solve math problems. So they can go from counting to adding, subtracting, even multiplying and dividing and solving word problems. Plus, they're going to be learning about conservation and classification. They're starting to have those abilities to do that. Next will be their language. So their language is starting to advance and they're fine-tuning it. It's almost adult-like in many ways. So whenever they speak, it will sound a lot like an adult's speech. So they can take those words, but now they can write those words out. So they can have creative writing. Plus, you can teach them grammar rules and they can follow those for their writing, and they can even learn how to spell words and write their definitions. And then lastly, social skills. So before, when the child was younger, they were really egocentric, where everything was about them and they didn't really have the ability to see things from other people's perspective. But now that is changing. They're starting to become more concerned about others and their perspective. So this is why you're going to start to see this shift with the child now wanting to form relationships with other people. They'll have these special friendships, especially in the school setting. So with the school-age child, it typically is among the same gender, where girls with girls and boys with boys. But that will change once they approach adolescence. So during this time, you will start to see the child playing with others. There's a variety of play styles that the school-age child engages in, such as cooperative play, competitive play, physical and constructive play, and they love doing this with challenges. So you'll see them maybe play board games, sports, like I said, competitive sports, but they also like to do things by themselves. They like to sit and read, play video games, and like to collect things. And some games you may see a school-age child playing would be like Simon Says, hopscotch, charades, jump rope, kick the can, tag, hide and seek, and so forth. Next is C for changes, and we're talking about the physical changes that that school-age child is going to undergo during this time period. First is height. You can expect them to grow about 2.5 inches per year, with the average 6-year-old being around 45 inches to, whenever they hit 12, about an average of 59 inches. And then weight-wise, they gain about 4.5 to 7 pounds per year. So the average 6-year-old should weigh around 45 pounds. So remember, 45 for the height and the weight. And then an average 12-year-old is around 90 pounds. Now, these averages are just averages, because if a child has the genetics, let's say both of their parents are really tall, well, they're probably going to exceed this height range. So just keep that in mind whenever you look at these figures. Next is their teeth. So before, when they were younger, they were getting their teeth, having to go through all that pain. But now it's time to shed those and get their permanent teeth that they'll have for the rest of their life. So around 5 or 6, most children tend to lose those central incisors, and then they will erupt the brand new permanent teeth. And typically by the end of this age period, about 12 to 13, they will have most of their permanent teeth, with 28 being in. Now, the average adult has 32 permanent teeth. So in a sense, we don't quit teething until we hit around the age of 21, where those last sets come in, those wisdom teeth. So during this time, the nurse definitely wants to provide dental care education. So teach the parent and the child the importance of brushing twice per day and flossing, and going to the dentist regularly, at least twice a year, every 6 months, because we really want to take care of those permanent teeth, because a child's at risk for cavities. If they have any bite problems or really a lot of crowding in their teeth, they may need orthodontics, so they can be evaluated for that. And then lastly, puberty. So as the child is approaching adolescence, their body is going to start changing. Now for girls, this tends to happen earlier than with boys. The girls, the average is anywhere between 8 to 13, and boys is 9 to 14. So as you can see with those ages, it falls within the school age. And with this, you want to make sure that you are educating the child about these potential changes that are happening and what's going on with their body. Next is H for harmful risk. These are safety issues we got to watch out for in the school-age child that you want to educate the parent and the child about, because again, these children are very active and they like to take risk and show off and compete with their peers. So we want to make sure that they're doing that safely. One thing they like to do is they like to get outside and they like to use equipment to play with, such as bikes, skates, and scooters. So we want to make sure that they're wearing protective gear, a helmet on the head, and other protective gear like elbow pads, wrist pads, and knee pads whenever they're using that equipment. Next is swimming. So you want to make sure that they are aware of diving dangers or deep water, like in lakes that could have undercurrents. They want to wear life jackets, and if they haven't already, to consider swimming lessons to help them with their swimming skills. Next, you want to educate them about stranger issues where possible kidnappings could happen, methods that kidnappers use to lure children in to be kidnapped, plus inappropriate touch, what's okay versus what isn't, and fire and gun safety. Keep these things out of children's reach, because at this age they're curious. They think they're big enough to play with these things, but they really don't understand how to use them. So keep them in a secure location. And then traffic safety. So during this age range, most children are still in a booster seat. So you want to make sure that you're following state laws with that. For instance, if the child is older than 8 and at least 4'9", they can ride without a booster seat. And then still with 12 and under should always be in the back. They should never sit in the passenger seat. The back is the safest for them. Next is O, obstacles at this age. So during this time, the school-age child is forming self-concept. And this is where the school-age child is going to ask themselves, You know, who am I and how do I fit in? And we want them to walk away from this stage of life having a good self-concept, because if they don't, they may experience depression and have low self-worth that may carry them throughout the rest of their life. So a main driver in helping them develop their concept will be, of course, their parents, but that school setting. For instance, with their peers. Do they fit in with their peers? Do they have the approval of their peers? And their teachers, because the teachers give them their grades and feedback, and that helps them determine, okay, yeah, I'm good at this. Maybe I'm not good at that. I can do this. I excel at that. And drives them with that. So what are some things to help a child with their self-concept that you can educate the parent about? One thing is to be positive and help highlight the child's strengths. Guide them with setting obtainable goals. So whenever they complete those goals, praise them so they feel confident with that. And care about their interests to help them grow in them and let them grow. And when they mess up, help them reflect back on what happened and how to improve next time. Another obstacle is bullying. This is where a child is being harmed or intimidated by another child. And typically this happens in the school setting, but it can happen outside of school. Another common place it's happening is through social media online. Now, boys and girls tend to bully a little bit differently. With boys, it tends to be physical. With girls, it's more of rumors, teasing, mocking, making fun of them. Now, what are some signs that a child is being bullied? You may see physical injuries on the child whenever they come home from school, and whenever you ask them about it, they can't really tell you a good answer of how they got there. They may be missing some school items. They may not want to go to school. They may be faking sickness a lot. Their grades are really poor. They're starting to have behavior changes where, before they were excited about going to school or didn't really care, but now they're starting to withdraw, become agitated and depressed, and you may see suicidal behavior. Now, what are some interventions for this? Well, you don't want to ignore it and hoping that it'll go away, but instead you want to get your child to open up and communicate to you what exactly is going on, their fears and concerns. Just let them know that you care. And then whenever you figure out what's going on, you want to report it immediately to the proper authorities and take an active part in getting it stopped, and let your child know that you want to get it stopped and that you care about them and that you are there for them through this. Next is weight and nutrition. So children at this age are at risk for obesity, known as childhood obesity. And obesity can lead to many health problems in a child, such as high blood pressure, type 2 diabetes, and joint pain. So as a nurse, you want to look at those risk factors with that child and see if they are at risk. And to help you remember those risk factors, remember the word heavy. H is for high caloric diet. So ask the child what they eat on a regular basis and look for things like junk food, fast food, sugary drinks, because these are things that add a lot of calories and not a lot of nutritional needs. E is for exercise lacking. And the U.S. Department of Health and Human Services recommends that children and adolescents ages 6 through 17 do 60 minutes, so 1 hour or more of moderate to vigorous physical exercise daily. A is for accessibility, limited to healthy foods. V is view food as a way to deal with stress. Some children who are experiencing stress at home, in school, or depression will eat to help cope with that. And then Y is your genetics and family dynamics. So how the family members eat, what's prepared on a daily basis, exercise habits, and genetics will determine how a person puts on weight. Now, some educational points you can provide to the child and the family about this issue is to try to make it a family effort. So set weight goals together and change eating patterns together, and to start slow. It'll make it a little bit more funner and make it a little bit more successful. Then to replace junk food the child likes with creative healthy foods. So instead, if the child likes lots of candy, try replacing that with vibrant, really pretty, sweet fruits, and to avoid sugary drinks and set a limit on that. And then avoid rewarding with food. You don't want to teach the child that whenever good things happen, it's always associated with food. Use something else as a reward. And to make exercise fun, so try bike trails, team sports, things that will burn calories, but it's fun. And another obstacle children may face during this time period is exposure to drugs, violence, and sexual content through media like social media or the school system. So some educational topics to talk to the parent about, because at some point these topics are definitely going to come up. They want to make sure that they're listening to their children, see what their children's being exposed to, pay attention to who their child's hanging out with, what they're doing on their social media, and to leave an open line of communication. So whenever these topics do come up, that you discuss them honestly, because they're real and they're just going to happen, and ways to deal with them whenever that does happen. Now, during this time, these children, especially as they approach adolescence, are going to start testing limits, and they're highly competitive. They like to win, they don't like to lose. So some behaviors that may start to happen is that they may start to cheat, lie, or steal. Next is the other O, which is for outcome of hospitalizations. So whenever the school-age child is hospitalized, there's some things that the nurse needs to be familiar with that the child can experience during their hospitalization. And one thing is fears. So the school-age child can fear pain/injury, really being stressed that a procedure coming up is going to be painful, or it may cause them a deformity, or they may lose a body part. So as the nurse, you want to be honest with the child. Teach them with visuals, with letting them play with medical equipment, going through it step by step, and helping them develop coping techniques to deal with this. They can also have a fear of death or dying. They're familiar with this concept and that it does happen. They've seen it happen to people around them. And losing independence/control. So in the younger ages, whenever we were talking about like autonomy and losing control, like for instance, like with the toddler, this is a little bit different. The school-age child's loss of control is going to be coming from because they're going to have an interruption into their school routines. When they're hospitalized, they really can't go to school. So that leaves them without being able to see their friends on a regular basis, be part of what's going on in school. They may feel like they're going to get behind, along with being separated from their friends and even their family. So this is different. It's not that separation anxiety like our younger children had. It's more, I don't get to see them. Are they going to forget about me type thing? And then another thing is modesty. So as that school-age child gets older, they start to become aware of how it feels uncomfortable to expose your private parts. So if you have to do procedures that expose them, you want to take care that you are preserving modesty and that you're letting the child know that you are taking those steps. Now, as a nurse, there are some things that we need to remember as our role whenever we are taking care of the hospitalized school-age child. So I want you to remember the 7 T's. The first T is to take time to let them express fears, and then let them talk about those fears and coping techniques to maintain control, and be truthful about procedures and tests. All of that is going to help decrease their fear and anxiety about, the hospitalization and what's coming up. And when you have to teach them with pictures, outlines, age-appropriate videos, and medical equipment, and lay out how it will happen step by step. And be tactful with privacy, especially during procedures that expose their private parts. We want to maintain modesty. And then give them time for activities throughout the day. This is going to help provide distraction from the sickness, the hospitalization itself, and upcoming procedures. And plus, they start to get a little restless and bored when they're hospitalized, and that'll help pass the time. And then lastly, their friends. Keeping in communication with school friends is really important. So collaborate with the parents on how they can still stay in contact with their friends while they are hospitalized. And then the last part of our mnemonic is L. Learn developmental theories for the school-age child. One of those theories you want to know is by Erickson, and specifically what you want to know is what stage this child is in. The school-age child is in the industry versus inferiority stage. Now, our school-age child is very industrious. They yearn to accomplish things because whenever they accomplish and succeed at things, it instills satisfaction in them. They feel confident. And the whole goal of this stage, in order for them to progress to the other stages, is to have competency. So we want our child to walk away from this stage with a sense of competency. Now, this is really cultivated in a lot of settings, like in school, in sports, and with their schoolwork, because once they succeed at things, they're able to do it. It's like, hey, I can do it. Everyone else can do it. I feel competent. I'm knowing my role in this world. Now, what can happen is that they can struggle with feeling inferior, like inferiority. And what can happen with this is if a child has a physical limitation that prevents them from being able to accomplish something, or maybe they just don't have the talent to do it, so they feel inferior. So what we need to do with that, whenever that occurs, is help the children be able to cope with this. Let them know that not everyone can master everything. Sometimes it takes time. And just point out what things they are good in so they don't go there, because whenever they start to feel that way, it can lead to low self-esteem and just cause them to not really want to try anymore, to try to accomplish things. And then the next theory you want to be familiar with is Piaget's. So up till the age of 7, they're in the pre-operational stage, but whenever they get to 7 to 12, they're in the concrete operations. So remember, concrete operations. So our child is losing their egocentric thinking. They're starting to know that, hey, other people have opinions and perspectives, and they're turning into concrete thinkers, which is really going to help them learn skills and understand the world around them. We're not here at abstract thinking yet. That comes a little bit later. So with concrete thinking, with statements, they take it as it is said. They don't think beyond it or other scenarios or really look at that deep hidden meaning. That's a little bit later on. So here, as a child starts really going from 6 to 12, they're going to start being able to develop some skills such as conservation and classification. So let me give you an example of conservation. So let's say we have 2 plates. They're the same exact size, and I put 1 scoop of food, and it's the same amount of food on each plate. Well, I'm going to now remove one of those plates and put a smaller plate, but I'm going to keep that same amount of food on that plate. So whenever I have a child who, let's say, is a preschooler, they look at that, they're going to look at that smaller plate, and they're going to think that there's more food on that smaller plate than that larger plate. But if I have a child who, let's say 8 or 9, whenever they look at that plate and see what I did, they're going to say, hey, that's the same amount of food, you just switched the plate and made it smaller. So they were able to see the difference where that younger kid wasn't. Now, another thing that children can start doing is they can start classifying objects. So they can start to group objects based on their color, their size, and their weight, or even what that tool or specific thing is used for. And then the last theory deals with moral development by Kohlberg. So whenever we're talking about rules and conforming to rules, different age groups are going to do it for different reasons. So early on, up till the age of 7, a child is going to conform to the rules based on a reward that they get or a punishment they get. So if they act good, they get a reward. If they act bad, they get punished. But they don't really understand the meaning behind these rules and why they are there. Then as a child ages up till about the age of 10, they're going to start conforming to the rules because it lets people know around them that they are good. If they have good behavior, people are going to know them as being a good boy or a good girl. So this is known as the good boy or nice girl orientation. Then as they get a little bit older, towards the end of this age range, the child is going to conform to the rules because of law and order orientation. So they follow the rules because that is what society says and it's good for social order. Okay, so that wraps up this review over the school-age child. And if you'd like to watch the other videos in this series, you can access the link in the YouTube description below.